culture can be thought of in several ways, but it is sort of an amalgam of the different identities that any individual person carries. So a person's culture is really influenced it's often dominated by their ethnicity because that has such a strong influence on people's values and belief systems. But it's more than that. It has to do with their social situations, their religion, their gender, their sexuality, etc. All of that influences, their roles in life, whether they're a mother or a father. All of these things influence your culture. So culture is really a multifaceted concept. And there are a couple of different frameworks for thinking about culture. This is one way that I sort of think about culture, is that it's basically a plane that we all live on. And we all might live on different parts of this plane. And where we are on that plane influences how we look at the world. So we might look at the same exact thing, you and I, but see very different things based on the cultural influences that affect our perceptions of the world. And that carries over to anything, that we can look at the same anything and see very, very different things. In our world, we can look at the same illness and see completely different things if we have different cultural backgrounds. And I would argue that we as clinicians or people in the healthcare system have fundamentally different ways of looking at things than people who are outside the system and come to us.